Hi, welcome to HealthBeat. I'm Dr. Chris Bennett with Orient Family Spinal Center. And to my right is Dr. Hobbs.
Hello everyone, welcome back. Dr. Barry Hobbs with Hobbs Specific Chiropractic.
And to my left is Dr. Josh Hank.
Good morning everybody. My name is Dr. Josh Hank with Chiropractic Integration.
So last week, Dr. Hobbs and I, we spent some time actually discussing what got us involved in upper cervical chiropractic and why we became passionate about that. And what I wanted to do today was spend some time, Josh has been out of the country, he's actually been in the Philippines for the last 2 weeks. So I wanted to give him some time to tell us a little bit about his story and what got him involved in doing this type of work. So Josh, tell us a little bit about yourself and why you do what you do.
Absolutely. Well, my story actually begins the same as you and I. In fact, it's the same as everybody else's. In the beginning, when two cells came together, out of love, they formed a spark. And as you know, this spark formed an intelligence, and this intelligence formed those two cells into one, and that one cell began to divide into several trillions of cells. And those cells early on began to form into your central nerve system, and from those nerves came the bone, the spines that encase it and protect it, and the organs which come off of the sides. 9 months later, from that two-cell collision, a full baby is born with over several trillions of cells. And it took me 23 years to learn about that story, but most of us are walking around with that story. So that's what kind of keeps us all the same. Now, the moment we are born, that's what changes who we are, the circumstances that we kind of put our life into and whatnot. Now, growing up for me, I grew up right here in Warren, Michigan, and for most of my life, my dad was the type of guy who wanted to push me to always be my best. And he was a physical therapist and then again into a chiropractor. So my whole life, I had this kind of urge or this push behind me telling me to go into some sort of medical field. And that's what I did. I went to Wayne State for about 1.5 years to study pre-medicine. And about 6 months into it, after learning some of the beginning classes, I started to learn that something just didn't resonate with who I was inside. The whole disease, not the prevention side, but the maintenance and the management and the drugs and things like that. And growing up, antibiotics was something that I did almost every day. I was sick maybe 3 times a year. So it was just something that I knew wasn't right, and I wanted to find a better solution to that. And at the time, my dad and I were actually butting heads, and because I wasn't continuing on with med school, and I decided to go to art school for 1 year. So I went to College of Creative Studies in Detroit for about 1 year. And the way the school works is you do a lot of your art projects, and it takes about a month to do them, right? And once you do those art projects, you turn it in to your professor. And after that month, I had turned in all my projects, and I'm working on them. And I'm looking around at everybody, and I'm seeing, mine is really good in comparison to everybody else's, right? And immediately my ego is going in overdrive. I'm thinking I'm going to get A or B on this. And I turn it in and I get all my stuff back. In 3 of my 5 classes, I literally was failing or I had a D in it. And I thought to myself, man, something that I love so much and so passionate about, how could I be failing in? So I wanted to improve myself. So I went to my professor and I said, hey, what's going on? How did I fail something? And I thought I did good. And you know what he told me? I never forget this. Is he goes, you followed all the directions that the assignment had outlined for you. You got all the points for the rubric, but you did a little something different. So in that project, it was a black and white painting, and I put a splash of color in it, just to do my own little style. And because it wasn't on his rubric, he docked me for it. In fact, he failed me in his class because I wanted to do something that was more my style, right? Kind of like the shoes I'm wearing. And to be honest, for me, I had to break away from that, and that was actually a trait inherent to me that I'm starting to learn, is that was something that I was always trying to rebel against my father, and all I knew was to run away from something when I didn't know what to do. Fast forward, I decided to go to chiropractic school eventually, after finding out that art just wasn't able to be tamed within me, and went through the chiropractic thing. And for 1.5 years, I got to that same kind of rut where I was wondering to myself, why am I here? What am I doing? Am I here just because, my dad told me to be here because he's a chiropractor? And my roommate at the time had invited me to a philosophy event, a chiropractic philosophy event. And it was with a local chiropractor named Dr. Eddie Weller. And there was this one quote that he opened up with, and it's that the power that made the body is the same power that will heal the body. Now, when he told me that, immediately every circumstance that ever occurred in my life was connected to that. Everything I had learned, every piece of biochemistry, anatomy, sickness, and health, everything has to do with that power, that subtle energy that started you from those two cells, that began your story and my story and all of our stories. And this story was just so amazing to me that I went home that weekend and I told my dad, about this story, and come to find out, he didn't even hear about this story. And it actually changed his life, and it gave him a better drive to taking care of his clients in the office. And quite frankly, it actually rekindled our relationship. So my story in chiropractic doesn't really have anything to do with fixing anything physical in my life, because it really did do all of that. But what was more important to me is that it helped bring my father and I together. It helped give me that deeper understanding of that subtle extra something that we can't really define, that it factor. And for me, that's more important than anything else. And every time I go into the office, I know that I'm learning from every person that I'm able to help. Just as much as I'm helping them, I'm benefiting from them because I'm learning through the process. Chiropractic, the first day I walked into class, I was in the same class as my wife, and now I have a 2-year-old son named Maximus. So I guess my story would just be a revolving one, because I don't tell people this very much, and I'm telling you guys this, but for the sake of discussion, if I were to pass away someday, and I know we all will, if I meet the Lord and he asks me, "Hey, Dr. Josh, I see you did good work. I'm going to put you back on the earth, and you're going to be reborn again. But you have control over only one single thing in your life. What would that be?" I'm going to control everything else. If you can control one thing, what would it be? I would absolutely, positively tell the Lord that I would love to be a chiropractor again, because it truly gave me an understanding of absolutely every single thing in life. And the beautiful part about that is that same power exists inside of you, and exists inside of all of us, right? It's keeping everything alive and in alignment and harmony and in balance. So I hope some of you can resonate with that story, but
That's awesome.
The beautiful part about that is that's my story up until 3 decades, and I understand that my story is always changing and it's always adapting, just like we are. So I'm going on this journey, and I hope you guys never give up on your journey.
That's awesome.
Absolutely. That was
Thank
cool.
you.
Well, thanks for sharing that, man. We, I know all three of us are very passionate about what it is that we do, and so we're going to actually take a break right now. But when we do come back, one of the things you mentioned early on was about pediatrics. You mentioned the kids,
Mm-hmm.
and one of the things we get a lot in the office is, well, why kids? Why do kids need to be checked for subluxation? What is it about kids? Why is it so vital that my entire family is under specific care? And so when we come back from break, we're going to discuss pediatrics and why it's important that kids get checked. So thank you for joining us on Health Beat, and we'll be right back. Hi, welcome back to Health Beat. As we mentioned before the end of the last segment, we're going to talk a little bit about pediatrics right now and why kids. A common question I get in my office all the time is, well, why do you check kids? Because when you walk into my office, you'll pretty much notice right away that we see a lot of kids in my office. And the reason for it is because as Dr. Hink was talking about, that one of the first things that happens is when those cells start dividing, the very first thing that's formed is the brainstem, which sits up here, and the upper brain, and then the spinal cord grows down from it. Then all the nerves grow off of that and actually start budding organs like fruit on a tree, right? And so that innate intelligence, that wisdom of the body is going on there from very, very early on. And as the baby's being born, whether it's through a normal childbirth, or what's considered to be a normal childbirth, or through an assisted, like a forceps or vacuum extraction, the baby's being pulled by the head, and as it's being pulled, the head's being turned and everything to get the shoulders out. And if you think about it, that's a lot of stress and strain on a baby's neck.
Absolutely. It's the head is a large item. It's equivalent to a bowling ball that sits on a little 2 to 4 ounce bone. and that's a large item. But the next biggest thing to come out is the shoulders.
That's right. And so, so we check children. Actually, our youngest patient started with us when they were about 5 days old. And we have a very specific protocol for how we check the babies to see if there is subluxation up there.
Sure.
Because like you talked about, Josh, that if that subluxation's there,
Yeah.
it's going to interfere with the way that brain is communicating with the rest of the body.
Right, absolutely.
And so kids never come into the office with things like, oh man, my back hurts. Baby's not going to come in with a back pain.
Right.
No, absolutely
right?
not.
Or neck pain. But what we check the babies for is to make sure that that body is communicating with the brain
Right.
at 100%.
Absolutely.
Because where true health comes from.
Yes, and the word subluxation that Dr. Bennett is talking about is a chiropractic term where there's interference of that communication from the brain to the body, and there's different steps and there's even different definitions within the chiropractic profession on this term subluxation, but we're going to simply call it an interference of the signals or the life force from the brain to the body, and that's the first spot in the spine to have that interference, because those are the first two bones that are formed in the spine, as we talked about last week in our show about the other 5 bones in our neck are not formed until they start holding their head up and start walking. And with girls, they start to form their curve in their spine at about 6, 7 years old, and us boys are typically a little later. It's about till we're 8 or 9. So that interference is what we're calling subluxation. It's a chiropractic term.
Right?
Absolutely.
Yeah, and so, that interference is obviously very detrimental, and you were speaking of that.
Yeah.
And so,
Like I said earlier, when I was speaking about how we were formed, and Dr. Bennett, you talked about Dr. Hobbs, you talked about the subluxation, the interference. One of the things, I wasn't fortunate to be adjusted since I was born. However, with my son, within 10 seconds of his birth, he had my hands on his neck, just checking him to make sure that he was in place, making sure he didn't have any subluxation. Now, being a chiropractor, we wanted to take the proactive measures, so my wife had consistent chiropractic care. So of course, pediatric care begins while the child is developing, ensuring that the mother's nerve system is also taken care of as well, right?
right, exactly. And so, same with my child. And I, if I could, and I know we talked about this before the show, there was kind of like, for me, my family is almost like a tale of 2 different children, right? So my oldest daughter, when we had her, we didn't know what we know now. My wife and I didn't. And so, she was never adjusted until she was probably, 4 or 5 years old. It was about the first time she was checked and adjusted. And so what we seen was, a pattern of the kid being sick a lot, like going to the, being around other kids, catching what they had, earaches, colicky, all those things that we think of as being a normal thing for kids. But common doesn't mean normal.
Exactly. And what do they do? And what do they do when a baby is trying to communicate that they're in pain? Their only form of communication is crying, right? So when a baby's crying, they're either hungry, they're sleepy, they're tired, or they're feeling some sort of pain inside. And a lot of times what we see as being colic is it could be just a pain in the body anywhere. And it takes a very specialized doctor to be able to address neurologic interference in the spine, the subluxation, and it's very difficult to find them in children, and you need a chiropractor that's trained specifically in that field, or at least has some experience with dealing with children.
Yeah, absolutely. I was fortunate enough after my son was born to be in chiropractic school, and as soon as he was released from the hospital, we drove in a Jeep 3 days later all the way straight down to South Carolina to an upper cervical chiropractor considered a brainstem specialist, because we wanted to make sure that stress and interference up there in that upper cervical spine was removed. So he was adjusted at 3 days old by Dr. Michael Kill, and we specifically drove down there to get that interference unlocked. He lived a life throughout school, not catching any of the viruses, not being sick, growing and developing as life expression should be, pure and healthy as can be, and not being reactionary as a lot of us are. And so as Dr. Hink had mentioned and Dr. Bennett had mentioned, we're trying to be proactive to open this up to prevent a problem. Right.
And like I was saying, so my first child, went through that. And then my youngest, he's been under care since he was a day old. So I checked him in the hospital, took the scanner in, checked his spine to see if there was any interference in this area. So he was actually fine. He came through the birthing process okay, and then about 3 months into care or into life, he developed a subluxation up there, and so we removed it. and we've kept him clear. And what we've seen is a kid who's, honestly never had an antibiotic. He's never had to have Tylenol, Motrin, any of that kind of stuff, because when he does come in contact with something, his body's gotten so strong at fighting things off that, if he has it, it's very short-lived and he kicks it pretty quickly.
Absolutely. I always love to use the story of a ship setting port. And when a ship sets port, it needs to launch at the exact degree, because it's going to take that launch and it's going to go in that one direction that entire time. But if that shipment is off just a couple degrees, he may land in a different country, right? So subluxation very early on in life can lead to a lifetime of problems because it happens so early. It has so much more time for it to develop. And like you guys were saying earlier, that subluxation doesn't possibly happen early on in life. It more than likely happens at that moment when the child is born, and then the bumps and falls as they get older. How many times do they bump their head? I know how many times I bump my head and I'm still an adult, right?
Yeah.
So
with that being said, when you look at health and what health really means, and I know we touched on this last week in our last episode, but health isn't really just about how we're looking and feeling. And so the World Health Organization, their definition of health is that it's not merely the absence of sickness and disease. So it's not merely the absence of symptoms, it's the body functioning optimally at 100%. Right. And so then you look at what is it that controls that function. Absolutely. It's the nervous system. To me, there's nothing more important in a well child visit than getting checked for subluxation.
Checked.
It just happens to be that we're this field is what does it.
Only profession in the world that can address subluxation.
So we're going to take a break at this point in time, and we'll come back in just a few minutes, and we'll wrap up today's show. So thanks for joining us at Health Beat. Hi, and welcome back to Health Beat. I'm Dr. Chris Bennett with Orient Family Spinal Center, and we've got Dr. Barry Hobbs with Hobbs Specific Chiropractic and Dr. Josh Hink with Chiropractic Integration. And I want to talk a little bit about some cases that we've had. But first, Dr. Hobbs, I'd like to have you tell us about a case you were telling me about right before the show.
Yeah, absolutely. So one of the things that we were talking about earlier is the bumps and bruises that we have as children. And even myself in my personal case, I know I'd given my story on one of the last episodes. I didn't realize it until I was 19 years old, whenever the chiropractor had examined me and said, "You've been in a bad accident, a fall," and I denied it. And 2 or 3 months later, I was getting my head shaved, and I have a scar on the back of my head from an accident I had when I was 8 years old, flipped off a bike, had stitches. So that impact of that head and skull hitting the pavement had torqued my spine out of alignment, and over time I developed symptoms. And symptoms develop over time, usually. In an accident, sometimes they can happen right away, and that's what we promote, is to evaluate that. So I had a lady from Texas, a grandmother, who had called and said, "Dr. Hobbs, you're an upper cervical chiropractor. I see one in Texas. Can you please help my grandson?" And I said, "Absolutely, bring him in, we'll evaluate him." Well, we were in a very busy day, and I knew right away when he came in because he was screaming nonstop at the top of his lungs. He was in his carrier. He was 2 months old. And everybody in the office literally started getting a headache because the child was screaming the entire time. As I eventually got to the family, the mother, and evaluated him specifically and detailed, and after about 45 minutes of paperwork and exam, literally got him adjusted, and he had colic. So he was just sitting there expressing that he was not well. And they had taken him to many other doctors beforehand, and they finally said, "Let's get him evaluated. Let's look into this upper cervical stuff." And literally in a split second after the adjustment, the child stopped screaming. And this was 45 minutes of a screaming child at the top of his lungs, disrupting the entire office. Wow. And as soon as it stopped, the grandmother, the mom, and literally other patients started crying because it was an instant release of pressure. And we know how it works, but to these family members and mothers and fathers and brothers and sisters, we love our children. We want them to be well, and that's why we're here on Health Beat, is to teach you about health and where it truly comes from. It doesn't come from a pill that covers up symptoms. And that was one of my most interesting cases, and I'll never forget it to this day. The little child comes in about every 2 months to get checked, and he is doing great and well, and he literally has not had colic since that first adjustment.
Nice, that's awesome. Dr. Hink, Tell us about how you evaluate a child, and how do you know they need to be adjusted? What is the steps and protocols for that for you?
Right. So every parent, when they come into the office, the biggest question they have is it safe, right? And like Dr. Hobbs was saying, we do a very rigorous and gentle evaluation process of the child to first determine whether or not we can help them in the first place, but also if it's going to be safe enough to give them adjustment. So one of the things we'll do is, like Dr. Hobbs said, he noticed that the child was screaming the moment that he came into the room. So we're picking up on these cues on how the child is behaving with the parents and with themselves. So that's where the exam begins. And then we start using our hands and feeling around. And the most part, we don't do any tough adjusting for these children. You know, they're very gentle. So I would use the amount of pressure as an analogy of the amount of pressure you would apply to a tomato without causing any bruising to it. That's about the amount of pressure we apply to the spine when we're evaluating, even in adjusting. What most of us tend to forget, though, is that children are not designed the way us adults are, so they must be adjusted differently, especially in the upper cervical spine, because that atlas is not fully formed and developed, so it has freedom to move about. And exactly, it has more freedom than we actually do to move about, so they're actually more susceptible to getting these interferences or subluxations early on and throughout their life. So our examination process, it determines how safe we are, and it also leads to the results that we have. The better our evaluation, the better results that we get.
Yeah, that's awesome. And just as a reminder for everyone, in case you don't remember from last episode, the atlas is that first cervical vertebra. It sits right up underneath the base of the skull, and the head sits right on top of it. And so a lot of times what happens is when that shifts and moves out of position, a lot of times the head will go with it.
Right.
And we'll get that sometimes torticollis in children. And I know, so we had a case one time, just to speak about how gentle it is.
Yeah.
I had a case one time where the mom, brought the baby in. The baby was not sleeping, only sleeping maybe 15, 20 minutes at a time. And when you're talking about a baby who's not sleeping, you're talking about parents who aren't happy.
No, not
I mean,
at all.
really. When you got a baby that's sleeping 15, 20 minutes at a time, there's unhappy parents.
Yeah.
And so, but the child couldn't help it. And it was sick a lot. And anyways, I did the adjustment. I evaluated, determined that C1 had moved out of position.
Right.
And it took a couple visits to really determine for sure if that's what was going on. Made a specific correction of that area, and instantly the baby fell asleep in its carrier. And slept for 3 hours straight, which is about with a nursing child, that's about how long they should be sleeping, is 2 to 3 hours.
Wow.
And so the funny part about it is that the mom said, "I thought you were going to adjust the baby." And I was like, "I did adjust the baby." And she's like,
She
"What do you
didn't see
mean?"
it.
Yeah, I was like, "I adjusted the baby."
Yeah.
Remember when I was holding the baby and I had my fingers on right underneath his ear? She goes, "Yeah." I was like, "That's what I was doing." And she goes, "Oh man," I think in her head she was picturing something else.
Yeah, it just takes so little, and that's the amazing thing.
And that's why it's great to catch kids when I once heard a quote one time that it's easier to have a child grow up healthy than it is to fix a broken adult.
Right.
And so, that's why it's so important to have children check early on, make sure they're growing into health and growing healthy from the time they're born. So I just want to wrap up today and just thank you guys for being here, being part of the show. And we'll be doing another episode here very soon, and we're going to start having some guests on here from different disciplines.
That would be awesome, yeah.
And so, we're going to have some different people. Some people talking about fitness, some people talking about healthy cooking, a lot of different things, because we really want to be a resource for the community for good, healthy practices. So, again, thank you, Dr. Hobbs, and thank you, Dr. Hink, and thanks for joining us today on Health Beat.